We're about to get started. Thank you all for coming. First and foremost, let me thank Empath and for putting together this amazing conference, Rugby Poverty Conference for 2026. As you all know, discussing solutions to these very complex problems requires a lot of strategic thinking and coordination and partnership. And it requires events like this for us to come together and share ideas and learn from one another, and more importantly, to build relationships. My name is Juan Bonilla, the Senior Vice President of Economic Inclusion and Wealth Building at the United Way Massachusetts Bay here in Boston. To my left is Nick Dunn, Vice President of Strategy and Senior Fellow at Sutherland Institute. Over on the other side, Victoria Accorsi, Community Financial Coach for the United Way of Pioneer Valley. And Nyesha Wornum, who is a participant of an exciting pilot going on today, and she's here to share her life experience. So thank you all for being here. Give a round of applause. So we're going to talk about benefit cliffs, right? This session will explore practical reforms, coaching strategies, and policy innovations that ensure work truly pays and that families can climb without falling backwards. I'm going to start by sharing a little anecdote from my experience and how I have come to learn about benefit cliffs. I started my career in the nonprofit world in 2004 as a housing counselor. And in that line of work, I began seeing families and individuals stop their journey in their tracks as they're hoping to buy homes, they're working to increase their income, they're seeking to save and build credit, pay down their debts, and all of a sudden had to drop out of the program. And inquiring about why, often the answer was that they were concerned or received a letter from their public benefits administrator they were going to lose their benefits. And at that time, being a young housing counselor, sorry, I don't want to yell because maybe the battery's going out, we'll see. Let's try that one. At the time, being a young housing counselor, I was having trouble understanding those decisions. Someone who is working hard to buy a home, all of a sudden stopping from pursuing their dream. And it was shortly after that, in that period of time, where I read a study about the benefits cliffs. And that's when the aha moment came for me as a practitioner. That's where the numbers began to make sense. That they were actually making rational decisions for their situations and for their financial picture. I realized that the decisions they were making was that they were avoiding getting into a much worse off situation. And so that's when I really became, entrenched and learned a whole lot more about benefit cliffs. And what sort of, in essence, the message here is that we were blaming individuals for making these choices to stay on public benefits. And instead what we're not realizing is that by design, our public benefits were punishing people who were trying to get ahead. And so I think here we are 2 decades later, still talking about this issue. So there is hope, and there's a silver lining in all this, and that's why our experts are here. We're going to talk about some exciting pilots and policy ideas that hopefully we can push forward and bring to fruition so that we can finally overcome and fix this design problem that we have in our public benefit structure. So first I'm going to start with Nick. I'm going to ask Nick to just give us a high-level overview of the benefit cliffs and the system sort of structure. Nick, take over.
Thank you, and wonderful to be with all of you today. Nick Dunn with Sutherland Institute. We're an independent public policy think tank in Utah, and I'm pleased to be here because of what was just shared in these kinds of conversations. I want to tie this into this basic principle, and maybe start with a question for each of us in the room. think about yourselves in your own work, in your own family life, and think of, well, how do I work and provide for the people I care about? And ask yourself this question. Let's say when this conference is done, you go back home, wherever that is, and your boss says, that was a great conference. You did a great job representing us. You're such a good employee. I want to give you a raise to recognize the work that you're doing. And you say, oh, that's great. Thanks so much. And then the raise kicks in, and you come to find out you're actually financially worse off than you were before the raise. If that was true for you or for me, my wife and I, we have 2 little boys, and my family is the most important thing to me. And if I believe that working harder and earning more at my job actually made my family worse off financially, or at least kind of stuck in the same place on kind of a treadmill, I don't know how I would deal with that. It would be so challenging. And that's why these conversations are so important, because we're drawing on all the collective expertise we have in this room to try and make a difference. And I want to tie it into something that we heard about earlier this morning in some of the other conversations, this idea that folks in poverty don't need a savior per se. They don't need to be saved. I want to frame it as you and I in this room, we are not going to solve poverty. The families who are desperate for work and independence and building the life that they want to build for their families, those are the folks who are going to solve poverty. Our job is just to clear their path and fix the public policy problems that make it harder for them to do that. And so when we think about what this is, I want to frame this around how do we talk about it to folks outside the room. And we've all probably heard the definition that a benefit cliff occurs when a family on one or multiple public assistance programs like food stamps, Medicaid, child care, those kinds of things, when their income increases in such a way that it triggers a reduction in benefits that cancels out the new income or eats up most of it or makes them even financially worse off. But if we put some specific examples to this, this helps to make it real, especially for policymakers and practitioners who may not be in the room right now. For example, in Illinois, there was a study from the University of Chicago a few years back. They found that a $1,000 wage increase, or just going from about $54,000 to $55,000 a year in annual salary, could trigger a loss of over $25,000 in child care subsidy benefits. Another example in the state of Georgia, if you use the Atlanta Federal Reserve Bank has a great cliff calculator tool, you can model this out. And just the other night, I plugged in, okay, let's say that in Georgia, a single mom in Fulton County could have her income increase from $23,000 to $24,000, so there's $1,000 increase in annual salary, and end up losing more than $500 a month in food stamp benefits. And then lastly, in Washington, D.C., there was a great study, again, from our friends at the Federal Reserve Bank of Atlanta, that found that a single parent in Washington, D.C. could have their income go from $11,000 a year to $65,000 a year, and not actually be better off on net because of the way these programs phase out. So I say all that to say that the core problem of the benefit cliff is not that people lose benefits. In our experience talking to these families, we've run statewide surveys in Utah, we've held focus groups, we've had families come on a weekly program at Southern called Defending Ideas to have these kinds of conversations. They don't want to stay on these programs. They want to work and have independence and self-reliance. The core problem of the benefit cliff is that it stops their momentum in moving forward. And we know that because of Washington University survey data that's nationally representative that found that about 22% of low-income workers on public benefits had turned down some kind of economic opportunity, like a new job, a raise, taking more hours, because they were worried about triggering a benefit cliff. Even in the state of Utah, where I live, which by many metrics is sort of the upward mobility capital of the nation. We have a great economy, lots of good opportunity in Utah. Even in Utah, we ran our own survey of the safety net population and found that 43% had taken some action at some point to intentionally limit their income because they were worried about triggering a benefit cliff. All this comes back to the design of the programs, or rather the lack thereof, that this isn't designed as a coherent system. And I think we'll get into some of that. But kind of the closing thought that I want to leave you with, as far as this kind of setting the stage portion of the discussion, we all follow to some extent, whether we like it or not, the political and policy debates that happen in this country can be very contentious at times. This is one of those issues where I really believe there is a lot of opportunity for bipartisan consensus building, that this is a problem that needs to be fixed. And so I want, if there's nothing else to leave with today, I want it to be this sense of hope that a lot of people who have a lot of different views on a whole slew of other issues can agree that with this basic American principle that if you work harder and earn more, you should be able to make your family better off, and a safety net that stops that from happening is not just an economic failure, it's a moral one that we can work together to fix. I'm excited to have that conversation today and moving forward to do so.
Thank you, Nick, for that overview. I really appreciate it. So now, we want to talk about the other side of the story. So I'm actually going to hop over to the other side of the stage because I want to talk to Nyesha. And I'll stand, that's okay, Nyesha, don't worry. I'll stand over here in the corner, right? So Nyesha, you're a participant in the Bridge to Prosperity program. You know, a lot of these sort of examples that we brought up, you lived them, right? So tell us about your experience back in those days, and you know, as you're striving and struggling, trying to make ends meet. Tell us what was your experience when you were trying to increase your income, and what happened?
Okay. Good morning, everybody. I'm very happy to be here. Y'all in the right room. I just want to say I'm still going through it. I'm still on the edge of this benefits cliff. Actually, it was in October 2024, just 2 months after completing my SNAP Pathways to Work program. I earned my IT certificate, and I proudly started working as an IT help desk manager, working 22 hours a week, working $22, making $22 an hour, working 22 hours a week. And that was but again, that was in the middle of the holiday season because we were in October 2024. So like the economy, I had to pick up shifts. I was a new employee, and I knew what my threshold was, which was at that $23 an hour mark, I would be losing some benefits. I knew that. But I had to do it anyway. So I had to make the choice, even though it was going to harm. And I am a mother of 2 children. I have twin boys who will be 4 at the end of this month. But when that came, I told my case manager about it. I said, hey, I'm gonna have to pick up some additional shifts, you know, just 3 extra hours a week. But the recertification date came. She plugged my data into the system, and my benefits went from $700 to $0 immediately. So it wasn't that my case worker made an error, it's that the system literally had no place for a temporary change, and it projected a financial forecast that was just inaccurate, and immediately put myself and my kids in harm's way during the holiday season.
Wow. And so tell us about what decisions you had to make after that.
Yeah, so as you can imagine, in the thick of the holiday season, I had to put that aside because the holiday season couldn't matter to me at that moment. So instead, when I got the call, I wasn't just thinking about the food benefits I lost. I thought about my child care voucher that's tied to this. I thought about my sliding scale YMCA membership. I thought about my access to the local food pantry because my SNAP benefits qualify me for that. I just thought about the domino effect that this just took, and how I was gonna solve this problem in less than a month because the change had happened immediately. So while I'm working, paying taxes, doing the things I'm supposed to do, earning more, I lost a great deal for not only myself, but it was just thinking about my children. So.
And what's the situation with your public benefits today?
My situation with the public benefits today is I'm still navigating this welfare track. We don't call it the benefits cliff where I'm from. We just call it the welfare track. And I'm still navigating it. I took my own lived experience and turned it into data to help other people. Right now, I know that I'm gonna lose it. interviewing for more jobs. I don't want to work part-time. There are 9 million of us working full-time and still trapped on the welfare system. So I want a full-time job. I want to be able to do that, but navigating the benefits.
Now, you are enrolled in the Bridge Prosperity Pilot, and tell us about how you came to learn about the Bridge Prosperity Program and how you meet Victoria.
Yes, so I got to meet all these lovely people here today. I'm actually a proud graduate of the Women Money Matters financial cohort, where I'm a financial futures graduate, and they had a platform that we can stay connected on, and I graduated there in 2023, and it wasn't until I hit the benefits cliff in 2024, then I just had to try to Google my experience. What is happening to me? How I knew that this has happened before. I grew up in the welfare system. I'm a child who has gone to summer camps due to SNAP benefits. I know the system. But it was just one of those things of, how do I get out of this? And Google gave me the answer. But first it came from the Women Money Matters platform, because they said, hey, we have this Bridge to Prosperity program that's tackling the benefits cliff. And if you have experienced any welfare loss, I was like, what's a benefits cliff? So shout out to Google for really helping me, because then I was able to learn, I was able to do all the research that I needed to do to help myself and get enrolled into this Bridge to Prosperity pilot program, which I am still enrolled in, and it's so helpful.
So how has the Bridge Prosperity Pilot helped you? Give us a little bit of a synopsis of your experience. You seem like you're happier now. So
Yeah.
tell us a little bit about your experience.
Like, the one thing for me is I've always been informed about the system that I'm in. I know what I was getting into, but you still can't. It's a social impact, right? It's a social impact on my health. That's what this is. The benefits cliff is no different from the SDOHs that we're studying now. It is one of those things that the Bridge to Prosperity program allowed for me to acknowledge that. And it allowed for me to see that. I got one-on-one coaching. I know some people got group coaching, but due to my affiliation with Women Money Matters, I was able to have my coach. And from there, yes, I got a monetary stipend that I was able to put toward my rent. But the most important impact for me was I was able to do something I wanted to do for a long time, which is start planning for my future and saving for my future. So because I had the money to put aside for my rent, I was actually able to start my retirement fund and go from there.
So, last question for you for now. If it was up to you, if you had that magic wand and you could change things, what would you change to make things better for people like you and experience things like you?
I would say that meaningful welfare reform has to start with the 15.7 million people that utilize the welfare system, work, and are still trapped there. I need you all to realize that we are working. We are doing that. We understand that we are scared. We know that, but we all want to do better. So start by shifting the narrative and the understanding, and stop dividing taxpayer and welfare recipient, because we are both. Aside from that, I would say that it's to also acknowledge the current system, that it is broken, and tackle those things straight on, and to bridge the information gap, because I should not have had to Google my lived experience. I think that we can be a part of the solution if you go into the communities that are affected, actually allow us to help to bring a solution, because the economy is one thing, but our social health is another.
Let me take this moment to thank you for your courage, for coming out here and sharing your experience. I know it's very personal. We talk about money and finances are very personal, right? Often people look at it as a definition of ourselves. But it is such a critical issue in my view, where people are struggling to get ahead. This is the American dream, right? You work hard. You're supposed to get ahead if you work hard. And that is not happening. It's actually not happening for most. And I think we see here that the individual experience is hindered by things that are beyond, or externalities that are beyond their control. And I think that's where we need to come in and recognize that the problem is not the individual failure, it's our system's failure. So thank you again for being here and doing this and bringing voice to power. Appreciate it. And I'm sure everyone here appreciates it as well. Victoria, fellow financial coach, how are you?
I'm good, how are you?
Great. So tell us more, well, give us a little bit of a background about you, and then tell us about this amazing pilot that you're involved in, Rich Prosperity.
Sounds good. Good morning, everyone. It's great to be here with you. So I'm Victoria Corsi. I'm from United Way, Pioneer Valley. I'm in Springfield, for any of my people that are local there. But United Way is a human services nonprofit, and we wear a lot of different hats. So we do financial coaching, we have volunteerism, we have leadership opportunities, and then we also have food pantries. And I've been at United Way for about a couple of years, and we have worked with Springfield Works for a very long time. And Springfield Works is the organization that houses Rich Prosperity. And they're an organization that's dedicated to advancing collective solutions for economic opportunity. So working with United Way, being a financial coach, I was able to become one of the coaches on the Rich Prosperity program.
Excellent. And tell us about the design of the program. So what are the components of it? Everything from how you're recruiting people to what's their experience, what's the design, and what are the issues that you're trying to solve here?
Yeah, definitely. So the Rich Prosperity program is a program that's designed to support hardworking parents who are looking to make a career change, whether that be working more hours, taking on a pay raise, or just moving forward in the career that they're currently in. And we do this through multiple different ways. The first one is direct cash assistance. So we place payments in different tiers between $300 and $700, and they receive those for 24 months to help them offset the loss of benefits as they are progressing in their career, whether that be, like I said, taking on more hours or getting that pay raise. And then we also provide financial coaching, like Nyesha mentioned. And some organizations do group, some do one-on-one. At United Way, I do one-on-one financial coaching. And then we do also offer a career coaching component. And we have a lot of different tools that we use to help folks navigate different careers, the different changes that they're making, and focusing on their strengths as well. And then we also connect with employers. So in Western Mass, we're connected with Bay State Medical Center, which is our local hospital. And then in Boston, we're connected with Boston Medical as well. So those are some great employer partnerships, which is really, really important for this program, which I think really makes it different, is that employers need to be aware of the benefits cliff and what's going on with their employees. Because it's not that the employee does not want to take that extra hours or that they don't want to take that raise. It's that it can set them up to be worse off than where they were. And it takes time sitting down with an employer for them to understand that and then change their method based off of that, like Bay State. Bay State actually did change some of their pay scales to reflect benefits cliff.
Well, that's excellent. So in the private sector, because it's private, an employer has decided to listen and make shifts in how they hire people and support people.
Yes.
Isn't that an interesting idea? Right. So you mentioned something called income transition windows, right? And tell us about how you help individuals, what is it, and then how you help folks navigate through those scenarios.
Yeah, definitely. So one of the things that we use is the Atlanta Federal Reserve Cliff Effect tools. Those are kind of our back pocket best friends when we're going through these situations with our participants. So they have this snapshot that we usually use first, where we pop in our participants' current financial situation and the goal or their target job, the goal that they're trying to reach. And from there, it'll give us an estimate of their loss in benefits. And from that estimate of loss in benefits is how we determine their payment support. And from that, we then take that and they have those monthly payments, but then we go one step further because there's two other tools put out by the Atlanta Reserve And one of them, you can actually plan out a participant's budget for 5 years, between 3 to 5 years, informed with the potential benefits losses that they're going to have, and including their payments and any other different things that go on with their budget, because everybody's budget is different, right? So we need those plans to adapt to that as well. So we're able to do that along the process and check in and make sure that we're hitting our goals and adjust where we need to.
So that's a good segue. Can you reference so far the incorporation of financial coaching? Can you give us a sort of more details, more context around what's the importance of financial coaching in this model?
One of the biggest things I think with the financial coaching in this model is it expands the participant's network. Because as we're moving forward through this time, our networks are our biggest thing to rely on. And those are the people that we need to fall back with. And MCAP, we have our personal support networks, and then we have our leveraging networks, right? And Bridge to Prosperity, that financial coaching, it's another person to add to your leveraging network and a community within that. So within the financial coaching, yes, we're hitting hard goals, we're hitting hard numbers, we're focusing on those things, but it's giving that participant an extra layer of support, knowing that they have a team of people behind them that are going to help them move forward and not let them fall.
Excellent, thank you. And in terms of public systems, what's your experience, the public benefit system, what's your experience interacting with the various sort of administrations of the public benefit systems as a practitioner?
Definitely. So, I think they're definitely not super well coordinated. It's really hard to talk with participants about one benefit, let's say DTA, and then or SNAP benefits, and then we're thinking of cash assistance and the child care voucher that's associated with that. And we're working through these systems, but they're not communicating with each other, which makes it much, much harder for a participant to do this on their own, but also feel secure moving forward on their own. So being able to have us here and kind of have a little bit more knowledge of the system, not be complete experts of everything, because there's everything that's always changing, but having that extra step really does help because the systems do not talk to each other.
So you also serve sort of as a traffic officer, trying to coordinate the various changes and communications and helping the participants navigate through all that. Excellent. So what are your recommendations what would you recommend, or what are your thoughts as a practitioner experiencing the complexity of this? Not just, you can imagine how it is for someone who's a public benefits recipient. You're a practitioner, you have a little bit of connection to the ins and outs of what's going on, and you're also seeing the struggles of navigating that. If you had your magic wand,
Right.
what would you offer?
Definitely. I think if I had my magic wand, the biggest thing that I would say is a lot of these programs, they need to be more participant informed. They need to ask the people who are receiving the benefits and struggling to move forward because the system's not made for them, what would help them and what would allow them to move past this cliff and be financially secure and stable and free in what they want to do.
Well, thank you, Ricky. That was great information, sharing your perspectives as a financial coach. Appreciate you for telling us and giving us your expertise.
Thank you so much.
All right, so now I'm going to hop over back to Nick. So Nick is obviously immersed in the policy world, and there are some ideas that are on the table that are worth thinking about and exploring. So Nick, can you tell us a little bit about sort of these policy ideas working their way through our federal government at the moment?
Sure, and I want to articulate sort of some context for the policy discussion, something that you said at the beginning, that you're two decades into the benefit cliff issue. And I think part of that is recognizing that this actually is a complex, difficult issue to solve because of the way these programs are structured and what they report to as far as federal entities. And that's why the reform conversation and some of these ideas that are being tested out at the state and local level and that are being contemplated at the federal level are so important. And just to give an articulation of that, the if you look at any particular program that you want to fix. So for example, one of the things that's been recommended, I was a co-author for a publication with the American Enterprise Institute called Stranded by the Safety Net, and it kind of lays out some evidence base for why you need to fix benefit cliffs and outlines some framework for how to start to think about doing so. One of the recommendations is, well, we just need to change the eligibility rules for programs so that the phase-out rate is actually consistent and pro-work. So for example, I've heard many times, I'm sure some of you have heard that the food stamp program is statutorily designed to phase out at a 30% rate. So you earn an extra $1 and you lose 30 cents of your SNAP benefit. There are sort of problems with the way it's implemented as far as certain exemptions or kind of when the phase out starts, that it often doesn't actually work out that way, where we do have large dollar amounts sometimes being lost all at once. But let's say you wanted to fix that. You said, well, let's just change the eligibility criteria so that the phase-out rate is consistent, and if you earn an extra $1, you're always better off. If you want to do that, the food stamp program is overseen by the U.S. Department of Agriculture, which is reauthorized in the Farm Bill at the congressional level. So you say, okay, well, let's work through those kind of channels and reform the program. And then if you said, well, what about other things like Medicaid? The Medicaid cliff is another big one. In our survey data in Utah, Medicaid and SNAP are the two programs most often cited that people are concerned about triggering a cliff. If you want to go and reform Medicaid, it's a different federal entity, Center for Medicare and Medicaid Services, and it's a different, essentially, legislative mechanism in Congress that would reform that program. And if you just go down the list and say TANF, cash assistance, and the housing Section 8 assistance goes through HUD and is, again, a different legislative congressional mechanism. So it's actually really complex to have cross-program reform, which is really what we need. And so one of the biggest reforms that I think is really promising, and stop me if I'm jumping ahead too much, Juan, but is that there is a bill on the table now in Congress called the Upward Mobility Act, sponsored by Senator John Husted from Ohio and Congressman Blake Moore from Utah. And what this would essentially do is create a pilot program to allow up to 5 states to sort of opt in and test solutions to the benefit cliff problem. What these states would be allowed to do is take funding streams from these various programs, and it lists out up to 10 different safety net programs. It says we can braid these funding streams together into one integrated pot of resources, and then essentially create and test a new program idea to help folks in the way that we would want the safety net to help them. Let's provide temporary help while they're struggling, and then help get them back on their feet and into full-time work where they can provide for their families. And so those are a couple examples where there are some things we could do programmatically at the federal level, and we should still have those conversations. But because of the fragmented nature of the safety net, it's going to be really hard to achieve that kind of comprehensive reform. It doesn't mean we shouldn't try, but we should also look at, well, can we empower states to be a lot more innovative? So that's, I think, a really important place to look.
Thank you. And we'll talk a little bit more about the Upward Mobility Act in a minute. But you guys are testing out some things in Utah as well at the state level. Could you share a little bit about those activities and strategies as well?
Sure. So what we found was in Utah, there was a question of to what extent is the benefit cliff issue truly structural, where it does create a material disincentive to working more and earning more, and to what extent is it perceptual? Sort of folks are afraid of the benefit cliff, but do they have an accurate sense of what will actually happen to their benefits if period income changes? So what we did in Utah was we used the survey data, which I call experiential data, coupled it with anecdotal data, real human stories, and formed a coalition with Sutherland Institute, the governor's office, the legislature, the state agency that administers these programs, and worked together to create a pilot program in Utah using TANF funds. TANF is one of those sort of buckets of funding that has more flexibility than some of the others at state level to try different things and pilot different things. And it was last year, so the 2025 legislative session in Utah, we were successful in getting a $6 million TANF pilot across the finish line. It's a 3-year pilot, and essentially it has 2 interventions with a 3rd component. Number 1, it is going to test more robust community coaching and mentoring. So the Circles model, Circle Salt Lake has been a huge partner in our benefit cliff work overall, and they're fantastic. So things like that, just more robust community coaching, and navigation, coupled with some kind of data or tool or ability for participants to forecast what actually happens if my income goes up, what would happen to my public benefits, so they can actually make informed decisions ahead of time with accuracy and precision. And then the third piece of it is really robust data capture, so that throughout the pilot we can test what actually works, what actually helps families say, maybe that's not as bad as I thought, I can say yes to this opportunity. And where do we see the data showing we do need additional structural reforms that we'd have to pursue in Congress? So that's in the process of moving forward, and we're really excited to see. But again, that's one example of one state trying something that'll hopefully lead to some innovation.
Excellent. So let's talk a little bit about the Upward Mobility Act, right? I hear, you know, the attempt to create the structure so that innovation can happen and reimagination can happen. It sounds exciting. So where is it at the moment in terms of support? Is it at the beginning stages? We still have sort of a long journey to go. Also, I understand that this bill was put forth by a Republican congressman and a Republican senator. Here we are in a very blue, liberal, bleeding state. But as I read that, it sounds very common sense. So is there opportunity here for bipartisan support to move something like this so that we can at least begin testing out these ideas and hopefully think about how we can restructure our public benefit systems?
So the short answer is yes. I think there is a lot of opportunity for bipartisan consensus around this issue for a couple of reasons. One, I'll make kind of a federalism and political polarization argument first, that these issues we're talking about, again, we've established they're incredibly complex and incredibly important. With respect to many folks who work and serve in Congress, that many of us maybe have relationships with, I don't think Congress is always the best suited entity to have really complex, nuanced public policy conversations. Doesn't mean that they don't have an important role to play, of course, but I would certainly rather have my state legislature, and if I were in a different state, I would rather have my state legislature, my governor, my state agency administrators be the ones having these conversations and say, well, if we can be a little bit more flexible and innovative at the state level here, how would we design an intervention? And not have to rely on, again, multiple congressional committees and federal agencies and all of the difficulty that comes with what happens in Washington, D.C. So there's a very pro-federalism argument that states are better equipped for these kinds of things, generally speaking. That also bypasses a lot of the political polarization we see in Washington, D.C. I don't care which side of the aisle anyone falls on, it's just a very contentious time. We all recognize that. And so these kinds of conversations need thoughtful, constructive, nuanced problem solvers to come to the table. I think that can just often happen more easily at the state level. And then kind of leading into the bipartisan side of it is that what I like about the bill is it demonstrates sort of a couple of things, two of which are a little bit of intellectual humility. I don't know exactly the best way to solve the benefit cliff problem in every program for every family in every instance across the country. I don't think Congress does either, at least not yet. But if we lean into states and say, well, states that are can be more representative of their people, more responsive to the unique needs, and again, craft innovative, targeted, sort of constrained pilots to test concepts, that can provide the evidence base for the broader reform conversation that we need, where things like what they're trying with these work programs. In Tennessee, there's a bunch of TANF pilots, and what we're doing in Utah and other New England states are testing different things. We'll see what works and what doesn't, and both of those are equally valuable. And that's where I think the bipartisan side of this is that what my legislature in Utah would want to do and test is calibrated to what the elected representatives feel like is best in Utah. That's going to be different than Massachusetts, presumably. And so creating sort of a sandbox where there are some guardrails, but within those guardrails, you want to allow some state flexibility and innovation. That's where, again, at the local level, you can have folks that can be creative problem solvers and collaborative problem solvers, and the best ideas will rise to the top over time. And this has happened in the past. In the 1990s, when there was the big welfare reform conversation that took AFDC, 8 families with dependent children, turned it into the TANF programs, some of those things were started at the state level with state pilots. So again, there is a model that state pilots can lay some groundwork for some federal reforms. that are the kinds of conversations we need to be having, but we need that evidence base. And that's why I think this is a bipartisan way to do it, is that, at least at this stage, I don't want Washington, D.C. telling every state exactly what they have to do in every respect. A little bit of innovation at the state level is really beneficial.
Excellent. And I think that, again, with the Bridge Prosperity and that conversation happening, I think there is some of that discussion happening here in Massachusetts as well. Magic wand question, Nick. If you had the magic wand.
Can it be a two-part magic wand? Can I wave it twice? I don't know what.
Oh, absolutely. If I can give you all the power,
Okay.
what would you do?
So the magic wand question is twofold. It's number one, if I'm speaking to folks at the state level. So each of you who are experts and practitioners and service providers and advocates in this room, this applies to you as well, even if you're not an elected policymaker. But the first part is we need to make sure that our states, our governors, our legislators, and our state agency or government entity administrators that help to run these programs, that at that level, all those folks feel a sense of ownership that the best opportunity policy and upward mobility policy comes from states and local governments working together. That's where the best ideas come from. Not usually from Washington, D.C. Again, I have a lot of friends in D.C. There's good people there, even if it doesn't always seem like it is in the news. But the best innovative ideas will come from the local level. So magic wand number one is I would love for every governor in the country to, in their next State of the State address, that, for example, say to their legislature, I want to make our state the best state for upward mobility when it comes to reforming the social safety net, to clear the path for these families to work and work more and move toward economic self-reliance that they want for their families, and for the legislators to buy into that. So that's the state level. That's magic wand number one, that all states say, we're going to be the best at this in the nation. What magic wand number two is for the federal government to say, we are going to equip the states to actually pursue that goal. And so the right starting point in my mind is for the Upward Mobility Act to progress, to get some bipartisan consensus, and to pass. And again, it may be one of the relatively few issues where I actually think there could be bipartisan consensus to get something substantive passed. But then it equips the states to be the innovators. So those are the two things. If we can make that happen this year or as soon as possible with a sense of urgency, that would make a huge difference.
Excellent, thank you. So, so we are ahead of schedule, so I would like to first give our panelists free form. Any nuggets of information that we either glossed over or did not hit the nail on, that this would be the opportunity for you to sort of add more context to the conversation. I'm looking at Victoria, I'm looking at Nyesha. You guys are good for now? Yes?
I was going to say, from the questions, I'll probably get there.
Okay. And Nick, I think you hit all your points as well. I would like to make one point, and then we'll take questions. Yes, I promise. But I also think that as a country, we need to have a sort of a connection back to our values and the narratives. I think we still, when we have this conversation, the default is that if you're poor, it's your fault. And that poor people are lazy, and they're not working, and so if they work harder, they're going to be okay. And then it takes away from the ability to have these very important conversations on how do we make things better? How do we reimagine, the way we administer and implement our systems? And I think that, and from a values point, I think we need to shift to all of us, a conversation about all of us, not just about individuals, right? Because this country was built on individualism, right? You work hard, you reach your dreams. But I think the reality is that we're all interconnected, right? Your success is because people around you gave you opportunity. People around you supported you. People around you sort of shared knowledge with you, shared connections with you. So we don't do it alone. We really do not. And then add to that, how we intersect with the economy, how we intersect with public structures, how we intersect with where we shop, where we live, right? We're all interconnected. And when we shift to, let's first make sure that we're all okay, right? It's gonna be hard to move to a solutions-focused mindset. So that's my pitch to this is again, the narrative about, sort of working and working hard. working hard is important, right? It is part of the equation, but we need to work hard and have a path to opportunity. We need to remove these systems that hinder progress and punish people who are trying to just get ahead. And I do think that when we start thinking differently, then we will start reimagining differently as well. So let's move to a Q&A here. So yes, sir, in the back.
Morning. My question's for Nick. So we've been talking about this at the federal state level. We've also been introducing some programs kind of on the ground. Can we talk a little bit more about on the ground? So for an economic mobility engine workforce development program in the Hampton Roads area of Virginia. Our program provides a stipend for individuals that are going through the program. Right now it's $350 a month. We're trying to get that to $500. We want to take that to $750 a month next year. As we are working on growing that, again, this is our primary focus here. So is there a way to, on the ground, navigate the system to where the programs that we create are not contributing to the problem? And are there policies that give exemptions if you're in a workforce development program and you're receiving funds that you're exempt from losing benefits? Can you speak a little bit about some of that?
Sure. So maybe to the first part of the question, kind of how do you navigate that in a way that we're not, if I understood it correctly, making the problem worse or kind of continuing the problem? And that actually goes to one of the core debates about this issue. So in the years that we've been involved from Sutherland Institute, I've been in rooms like this, and folks on the left and folks on the right, and everyone in between. And what I've tried to tell folks is at first, if we can build consensus and it's a problem we need to fix, we all agree, let's fix it, then we can argue about the solutions and figure out what works. And the reason I say that is that if you're looking at the local level and say, well, how do we create programs, add layers that don't make things worse? I think there's sort of two guiding principles that would be really important for those local programmatic evolutions, if you will. Number one is the fiscal realism and the scalability of the program. And so it's at times we might see pilot programs or test interventions that bring a lot of really intensive resources to the table, and say, well, we have some good outcomes. But then if you were to kind of upscale that to a city level, a county level, or even a state level, and if you were to just replicate or scale it, it might be prohibitively expensive. It depends on your state, perhaps, but then the state legislature, maybe it's just a non-starter. So that's one, is that whatever we're trying, especially at the kind of local targeted level, we have to be realistic about, if this goes well, if this does what we hope it to do, what's the next step? Is it true scalability? Or is it we're learning data and evidence to inform the reform conversation we need to have in our state capital and our US capital? So those could be two different objectives for those kind of local programs. The second part of that is that I think making sure those local programs are anchored to sort of this, kind of the theme I'm taking away from this is this core American principle that families want to work hard and earn their own success and be independent and self-reliant. And whatever programs we would create or add or alter should always be with an eye towards, well, how do we help them get to that point or clear their path so they can get to that point? Rather than just, well, if we add this program, does it just move the benefit cliff phenomenon a little bit higher on the income scale, but doesn't actually fix it? Is there still a work disincentive, but now they're just facing it at 5 or 10,000 or 15,000 higher in terms of earnings than they were before? And so thinking about the way we deploy these interventions, we really need to think about that smooth roll-off, that phase-out. And again, with an eye towards, is it scalable or is it learnable as far as influencing other reform conversations?
Thank you. Another question? Yes. And I didn't notice the mics here in the center, so my apologies, but yes, if you don't mind. I know it's a little bit of a journey.
That's okay. Hi, my name is Barbie Leon Hallam, and I'm here representing a nonprofit called Powerhouse San Antonio out of Texas. With all due respect, I think because our hashtag is disrupt poverty, I think it's really important to name that, first of all, I live in a state where the governor is Greg Abbott. So when we're talking about like these congressional or federal, even state level solutions. I think it's a real disservice to dismiss the reality of where we are right now today in our families and how urgent the need is to find workarounds, really. Even we as nonprofits, I'm sure, and I'm looking to Nyesha because in my opinion, Nyesha should have had 75% of the forum today to speak because that's who we really need to be listening to. And even as nonprofits, as we're taking funding from, other pass-through entities, we are noticing that as nonprofits, we're putting up barriers. We're asking for people to provide bi-weekly, weekly paychecks. We're asking them for their tax returns. We're asking them for social security numbers. We're asking them for IDs, birth certificates of their children. And we're seeing this as like a federal problem. This is huge. And unless we start looking and calling it what it is, it's the welfare trap. If we were listening, Nyesha named it, right? And we're using all this language and talking in circles about things that haven't worked in forever without really getting down to the causes and saying, Nyesha, what do we need to do? You, what do we need to do? Community member, what do we need to do? How are we standing in your way? What are the workarounds that we can employ to make sure that our focus and we're centering on our community members? That is the entire Disrupting Poverty Conference, #DisruptPoverty. So thank you.
Thank you for that.
I would say to that piece, that's why I founded Beyond the Safety Net. It is very important to me to be able to partner with local communities that care. I don't care what state you're in, this is a national problem, right? So I find that while policy takes time, community can go faster, right? So don't let it be discouraging, but use that, because when you do take those programs that you do have, and you find, when you partner with the people that are there, we then can be louder with our data. I believe that data switches the narrative, so keep going.
Thank you for that. And to piggyback, thank you for calling that out. We're a system too, right? The nonprofit system. And it has existed for decades. Practitioners, philanthropy, we have also created structures that are contributing to the problem. And so I would encourage all of us that are your own organizations to engage in these discussions around how we can dismantle some of these, structures that are, you have control over, so that we can, create the space for families to be able to not only access your services more quickly and better, but also be treated with a bit more dignity and respect, and also have that sense of partnership as co-equals, right? We could talk about that for a long time. We're having that discussion a lot around, philanthropy and how we donate and how we give resources that come with nth million restrictions, which then force you as practitioners to create very structured, sort of programs. So there is this cycle that we need to disrupt. Yes.
Good afternoon, everybody. I stand here as a practitioner and a participant, and I just want to leave 3 nuggets. The first thing that we need to do, I believe that calling it a welfare trap is a great description, but it's also legally loan sharking benefits. Because when you receive public assistance that from the tax funds that we paid into, so if I lost a job, I was part of the tax system, I paid into these benefits. So for you to give me a benefit back and tell me I have to repay my child support, I have to repay this, and this, and then you're making administrative fees off of not collecting the child support that we were entitled to, that would allow us to not even be on the public benefit system, that our kids grow up, and then we have this austerity politics, because to me, you gotta step back and even redefine this need that food, housing are human rights. When you start the conversation that way, then it isn't about what you're giving me, it's actually what I'm giving you. And then the administrative state is a state of extraction. You extract economic opportunities, you extract futures, you cause intergenerational financial genocide by even participating in a system that gives me $400 and expects me to live. I did a master's program capstone where we went to Dublin, Ireland, who has a fantastic system. They support you once you get to the cliff. They support you with benefits consistently for 2 years. And the rate of recidivism or needing these benefits again are substantially decreased. So, and then the last thing I want to leave you with is I haven't heard anybody say that the stakeholders are the actual participants. And here at DTA, they did do focus groups, but they don't listen. So even when you come to the table and you're telling them exactly what you need, it's still this belief that I know better than what you need because I'm not really listening to you. So what I would say is that don't tell me what you want to do at the state or federal level until you have been forced to choose between eating, going to school, or putting clothes on your kid. You're not even entitled to engage in the conversation that you can't conceptualize.
I can't follow that up. Thank you for sharing. We have to sit back and rethink what we're doing. I mean, again, if we continue what we're doing, we're going to get more of the same awful result. So we have to try different things. So thank you for sharing what we should be seeing as the obvious, right? Let's take another question. Someone up here had their hand up. Did you have your hand up? So I'm going to call on her first because I know you had your hand up a few times, and then we'll come to you. Is that okay? All right.
Hi, my name is Nyesha Wornum, and I'm here. I work for Community Land Trust, Boston Neighborhood Community Land Trust, but also am someone who is, like, just because you work for, I'm not separate from you in this room. I am going through, like, trying to navigate that whole thing, and I just want to say a couple things. So benefits, I heard it referred to as like a safety net. It's not a safety net, right. It is a trap. The safety net comes when you're able to like jump off of that cliff and hope you get to the other side, and if you don't, there's something there to catch you. And then you get to do it again. You get to stay alive and do it again. Like the cliff means you're gonna die. A lot of people don't take those chances. It's because when they fall, they're gonna bring their kids along, and they're gonna bring their family along. And we don't say, like, we need to change the narrative or people need to understand that if you get a raise, it's not just like they're taking the amount that you get a raise. Like you're literally, all of these things that are helping sustain you are, you never gonna get that amount of raise before all of that is taken away from you. So people need to understand that people are not just being lazy. They're not living off the system. There's nothing the system is giving you. If you have a Section 8 or voucher or any of those things, you are not living high and mighty. $400 a month is not like in your pocket, is not helping you live your best life. So I just want people to understand that. And I think like, I love the fact that we're thinking about this kind of safety net to help people be upward and mobile, but also like what is the wraparound services? Say someone for 2 years is on this program, but they don't get those raises enough that after the 2 years, now they've sacrificed all that other stuff trying to be upward mobile, and then they fall at the end of it. I only say this because like there's a voucher program out there that helps for 2 years, and then if they're giving them to people who are on fixed incomes, like after 2 years, like that's just a setup for failure. So we need to think about like after those 2 years. And I think the last thing that I want to say, I have a lot of stuff to say, but the last thing I'm going to say is that I don't like the word like innovation in trying things out. Like that is for computer work. And that is for people. You need to think ahead. You need to think about these things that you're implementing and not like, we are not experiments. Like, we are real human beings. We are in this position not because we chose to be in this position. My mother couldn't make it. She didn't want to help me. There are systems in place that made it to where we are. This is not our fault. And those systems, those people who are part of those systems need to make sure that they are part of the solution. And I just want to say to you, Nyesha, I am glad that you shared your story, but I hate that you had to. And this is not the way that we should have to share our stories. We should be at the table with these decision makers and talking about how the decisions that we're making, we need to be a part of those. Like, we don't need anybody to make decisions like based off of their experience. Your experience is not her experience. So if you're trying to help over here, then she needs to be a part of those conversations and not just extracting her story from her.
Yeah.
So I just want to, it brings up a lot of stuff and I can talk forever, but thank you guys.
Thank you. A lot of great things. Thank you. And you said it, so I agree with it 100% as well. I think you're bringing up a lot about our power structures and how decisions are made. Those are all critical as well. We're at 12:10, but I'll take 2 people standing. So if we can make the questions very quick, because we were ahead of time and now we're ahead of time. So thank you.
Nyesha, thank you for what you shared, and one thing that you shared that hit me was you having to Google like the terminology for what you were going through, even though you deeply knew it, and generationally knew it. And so one thing I'm wondering as someone who works directly with financial coaches is how can we, especially with your work with Beyond the Safety Net, how can we help to provide that shared language, not the education about what you're going through because you know that intrinsically, but connecting those dots so that there is more community and more shared knowledge of the terms that we might be using in this sector, so that you're able to kind of come to that table with a free and clear path.
Thank you. And the last question? Oh, did you have something to say? Go ahead, Nyesha, I'm sorry.
Just so you know, I think that's important that you actually host information circles that surround the benefits cliff. It needs to be something that is cycled through all the communities that we have. We should not have to Google it, but one of our big things with Beyond the Safety Net is shifting how you tackle financial literacy, right? You have to start with money relationships, understand how and why people are moving with the money the way they are.
Right.
Welfare trap creates scarcity mindset. Transitional financial literacy, that's not what, right? You use it, you can't save more and earn more. It doesn't,
Yes.
you see that? It don't work. So I think that just going into changing your financial literacy approach, and then also being okay going out there, saying the benefits cliff, but tie it to welfare, say welfare trap too.
Right.
You know, that's how you're gonna get the people there.
Right.
Thank you. And this is going to be another great question, and it'll be the last one.
I am going to challenge all of you, because if you remember, last July we had the One Big Beautiful Bill Act, which is always fun to find out what people call it. My personal favorite is OP3. But one of the things that it did do is it kind of created another whole cliff of people who can't even get on the benefits. And so we now have veterans, kids exiting foster care, people, what is it now, over the age of 55 to 65. So you actually have these groups, and has anybody ever taken a look at the current U6 rate? Those are the people who are like kind of out of the workforce and can't get into the workforce. It's currently at either 8.9 or 8.2, I'm not sure. So these are people that can't even get into the workforce, but yet they are being told that they need to be. Veterans have a lower rate of hiring by private companies. Kids coming out of foster care, there was this, I heard that somebody, Dr. Anthony Jakes not too long ago, that even when they go to college, they don't actually take advantage of all of the things because they just don't know how. They will take a janitorial job as opposed to a research assistant. AARP came out with a study about a year ago that says if you lose your job at 55, you have less than a 1 in 5 chance of ever getting another job. So we are talking about one of those weird things that Nyesha actually had something, she said, I grew up in the system, I knew where to ask. So we have created a whole new cliff for people that has just been exacerbated in the last year. And so these are, if you're talking about senior citizen or somebody raising grandchildren, you're not necessarily talking about what we are now, the Ronald Reagan welfare queen, and I hate that term, but it is something that we have. And who works harder than somebody in poverty? And that's the other thing. Work hard. The truth is nobody works harder than somebody who has to figure out how they're going to do all of these things with not enough time, because we also do not talk about time poverty and the cost of time and things like that. So we have other cliffs that we're not even discussing anymore, and they're getting bigger. And one other thing, classic economics with free market and capitalism, you're supposed to take care of the input level too, and labor is an input. And private companies like Walmart give their people these weird scheduling issues and how you apply for benefits. So we need to look at private industry too and explain to them how hard people in poverty work.
Yes.
Thank you. Time for definitely a lot of work to do for all of us. But again, thank you for being here and sharing all your passionate, some suggestions and commentary. Again, I think that there is opportunity here for us to, again, start thinking about this problem not only differently, but start doing things differently. It all starts from the bottom up. Maybe we're talking about building a movement. Thank you.
Thank you so much. I'm Vivian from Empath, and I helped pull together this amazing panel, including our wonderful moderator. Please give them one more round of applause. And I just want to remind you that the book sale table is open early so that you can purchase a book and be at the front of the line tomorrow. Get inside. Thank you.
Thank you, Bill.
It comes in here. I have a slide in. I don't know if it's
I'm
finishing my master's right
now,
and I would die to read it.
So I'm gonna send you that because my actual capstone was on women of color being the solutions and savior to the private sector. And I'm actually working on my unified doctoral thesis, which is applying all of these elements, right? The integrity gap, the comprehension gap, the competency gap. So yeah, I'm gonna share my.
I don't have no comprehension.
I don't have
Can
a
I take
copy.
that?
Please, yeah.
I don't go ahead. I'm trying to bring it on.
817, yeah.
Listen, I'm trying to talk to you.
I got you.